Would it be better for somebody to get an autologous chondrocyte implantation? So that's ACI, autologous. Autologous means it's your own cartilage cells. So when we do bone marrow prolotherapy or stem cell prolotherapy, it's autologous because we're using your bone marrow cells. We're not using my bone marrow cells and then transplanting them into your knee. We're taking your bone marrow cells and transplanting those bone marrow cells into your knee. So that's autologous. What most centers do is, like for instance, at the major medical centers, that will take out your cartilage cells, your own cartilage cells, grow them, and then implant them with a second surgery into an articular cartilage defect. So that all sounds really good, but all somebody has to do is go on the internet, look at the long-term results. You know, I'm not happy with the long-term results of that. And you might say, well, why, doc? Well, who do you think sees all the failures? You know, who sees all the failures? We see all the failures. So we see, you know, these folks get these surgeries, and the athletes that we see anyway, they don't, you know, get back to their activity. So autologous chondrocyte implantation has a role, but I think that role should be after you failed bone marrow or stem cell prolotherapy. It shouldn't be after. Like, you shouldn't get some surgery. It's two surgeries. To do autologous chondrocyte implantation, it's two surgeries. You know, plus it's, you know, over $100,000 or more of expense. It's months and months and months of, you know, rehabilitation. You know, when like for instance, I've had 3 bone marrow prolotherapies. You realize after I've had 3, after the bone marrow prolotherapies, I can run within 5 days. I mean, it doesn't even interrupt my training schedule. So the good thing about bone marrow prolotherapy or stem cell prolotherapy, as it's done in situ, in its natural environment at Caring Medical, is it doesn't interrupt the athlete's training schedule. So, I mean, this is awesome. Plus, it's simple. It's done inside your knee, not in a lab. Like, all the differentiation or whatever has to happen to your stem cells and other bone marrow cells, that happens within your knee. It's not happening in some lab, you know, by some secret technique. It's just all done in your knee. The whole procedure, everything's done within minutes at the office here, so it's very, very simple, which keeps the cost way down. Plus, the athlete or the person, literally, you could get it and go right to work. Like, if you live in around Chicagoland, you could literally come here, get stem cell bone marrow prolotherapy, then you go right to work, and you could work a normal day. Like, after this interview, I'm going to get it, and then literally within an hour, I'm going to be treating a patient. You know, like, in other words, I'm going to go right back to work. It's not going to affect my job. It's not like I'm going to be in awful, awful pain. It's like, it'll just feel like normal prolotherapy. My knee will be a little bit stiff. So when my knee's a little bit stiff, I can work.